Gone are the days where you only discuss your health care in person at the doctor's office. With the technology age that we live in, you can get a hold of your health care information, test results, upcoming appointments, all by going online. So today we're talking about the Cone Health MyChart website or app. We're going to look at the basics of MyChart and more. Dr. Jitu Nanda, Cone Health's Chief Medical Information Officer, is joining us. All right, so let's talk about this. A lot of people have heard about MyChart, but maybe they don't know all the things MyChart can do. What is MyChart?
So MyChart is an app that most people, most companies have an app to connect consumers with them. And MyChart is an app that Epic, which your doctor uses for documentation of your health, has created for everyone to get connected to their doctor's office to take care of their health without actually having to physically contact the doctor's office. So you can do your medication refills, you can do your messages, get an answer from your doctor, you can even book an appointment for your follow-up or get your questions answered.
Okay, so MyChart's on the app. It's also on the website. It can be super stressful when you're waiting on test results. You go to the doctor, they tell you that they need to do a test, they do the test. How quickly could someone view their results if they have MyChart?
So with MyChart, with the 21st Century Cures Act, as soon as the result is available, you're supposed to be able to view that in MyChart, even before your physician actually reviews it. So you would have that. The advantage there is, imagine a cancer patient waiting for some very sensitive labs to come in on a Friday afternoon, waiting for the doctor to call. They can actually get the results and be assured that their results are within normal limits, or if they need to take any action, they can. The results, again, your doctor will call you or will give you a message on MyChart, but the information is available.
I know, I loved it even just for I had my mammogram, and instead of waiting for the letter to come in the mail to tell me what was going on or for them to call, I was able to look at that later that day and know that everything was okay, which is, peace of mind is huge. So it's not just the test results. You can also message your provider. Let's talk about that. How does that replace calling the office and leaving a voicemail and that kind of thing?
So just going back to it, you can actually even get lab results and physician notes, even if you've been to another health system. So it connects as long as they're using Epic. It will connect you. And you can get that information. How do you call and what? Of course, for emergencies, don't leave a message on MyChart. But instead of calling and waiting, you can actually leave a message which goes to a doctor's inbox, and they're given however much time to answer that question directly to you. It can be, hey, come in for an appointment. Or here's the answer. You're fine. Or go to an urgent care. So those messages are very easy. Sometimes you're just wondering about what you should do in a particular case, or you got a medication reaction that is not quite sure, but you would like your doctor to let you know in a couple of days if that is kind of good, bad.
Yep, that's exactly
again,
what I've used it for, is there was a medication and it didn't quite sit with me, and so I messaged back, and within a couple hours I was able to get something else instead of having to call, having to leave a message, having to wait, that kind of stuff.
Right.
It was really good. All right, so who would have access to the information? Because I think that's something that people think about, because with all the technology and you're hearing things, people can get into different websites. Who has access to your information?
So following the Health Information Protection and Portability and Accountability Act, or HIPAA, the information in MyChart is protected. So only those people that you actually give access to will have access to it. Now, for kids, It's different, right? A parent, before a kid becomes um, 16 or 18, there are nuances to that. They can give proxy access to parents, but it is your information. You can give access to whoever. I mean, I have access to my parents' MyChart. They're older, and sometimes they have questions. Is the lab's back? So where they're not very good with technology, and so I have access to their chart, and I can let them know. So that's a great thing for families to have, um, where they have instant access to their kids or their family members, their spouse, um, access, and they can be, if they are better informed about healthcare, they can be their coaches, their family members' coaches, and explain what the information means.
Okay. All right. Definitely can use that as a tool.